Now, South Africa continues to mitigate against the spread of COVID-19 infections. Are we doing enough to deal with what has become known as long COVID? A UK-based immunologist has said long COVID could create a generation affected by disability, with people forced out of their homes and work. Is South Africa approaching long COVID and its long-term effects adequately? Here to talk to me about this, I'm joined now by the head of the School of Nursing and Public Health at the University of KwaZulu-Natal, Professor Mosa Moshabela. Prof, good evening and thank you very much for your time and joining us tonight. We've been saying a lot about vaccines. We've been saying a lot about getting out of the state of disaster and so on and so forth, and the variants and so forth. I don't think we have spoken enough about the effects and the impact of long COVID. I suppose it was also still pretty early days, and experts were still learning a little bit more about this condition. What is long COVID?
Yeah, good evening, Thabo, and to the viewers. And I really, truly appreciate that you are also putting a spotlight on this issue. And I must say that this is an issue that we knew about even back in 2020. And unfortunately, at the time, there was still a preoccupation with acute COVID and acute admissions and severe disease and death, that we were not really paying attention to the potential long-term effects of COVID-19. But what we know so far about long COVID, the information has been increasing and growing. We know that essentially it's the long-term effects that people suffer from after they have gone past the acute stage of COVID-19. So either after about a month, 2 months or so beyond COVID-19, they continue to have symptoms. Most of the time it's tiredness, sometimes it's sort of forgetfulness, and other times it's shortness of breath. You find that someone who used to run cannot run anymore for months after they've recovered from COVID. Some people have been suffering from this ever since 2020. And we know now that actually it's a big burden, and it's causing a lot of pressure even on the demand for healthcare services. But it really affects the quality of life of people who suffer from long COVID after they've gone past the acute stage of COVID-19.
Yeah. How is this treated? I mean, what are the long haulers currently doing to treat these symptoms?
Yeah, this is also interesting, right? The people that started to describe long COVID were actually patients. It wasn't actually clinicians. It's only months later that clinicians started to pay attention to it and really started to have clinics. In other parts of the world, in the UK, in the US, there are dedicated clinics that are designed to provide care to people who have long COVID. Most of the time, it is supportive treatment. What we are seeing is that it's not only supportive treatment to, say, pathology that they have. So, for example, if they have tiredness or if they have respiratory symptoms, they provide supportive treatment even psychologically as well, because many of them, they have a lot of depression from not being able to do what they used to do before. But most of the time, it's supportive treatment, physiotherapy, rehabilitation. They kind of help them to take a few more steps than that they did before. And I find that even in our context, I learn more about long COVID from people who actually suffer from long COVID. And I wish that South Africa can also take that sort of process. I don't know of many groups that have dedicated research towards long COVID, except one group in Cape Town. But really, the people that are going to describe it well to us are the people who actually suffer from it, even in South Africa.
Yeah. And let's talk then about how long do we know these symptoms will last? I mean, do we know if, for example, they are attached to any variant? Do we know they are attached to any wave at all, or are all variants possibly producing this?
Yeah, after every wave of infection, you have people who end up with long-term effects. In fact, if you look at people who present with symptoms, you would find about 10 to 20% of people will have long COVID. And amongst those who you identify, you'll find that 80% of them will have mild to moderate symptoms. And then about 5% will have very serious symptoms. Now, other studies have actually looked at people who don't necessarily have symptoms, they don't report anything, and they just kind of invite everyone who has recovered from COVID to monitor them. And they have found pathologies that could help explain COVID-19. Up to 40% of people who have recovered from COVID-19 would have pathologies. So, Thabo, we are talking here about 1 in 5 people who recover from COVID having symptoms that are debilitating and affecting their quality of life. We are talking here about 2 in 5 people having some sort of pathology, even if perhaps in that moment it's not necessarily presenting with symptoms. And most of those pathologies are related to the after effects of infection with COVID-19. They tend to affect the small blood vessels, and they can be neurological, they can be respiratory, they can be related to the heart or other parts of the body. And these are the kind of things that I think they will then dictate or influence what sort of symptoms a person is going to be presenting with. And for some people, these symptoms, they've had them since 2020, and those symptoms are still ongoing. And we thought maybe they would last for a few months, but they didn't. They're carrying on even now for some people.
Can vaccination help treat long COVID? Does it mitigate? Does it worsen it? How does it work?
Yeah, so what we have found, the evidence that we have so far suggests that for people who are vaccinated, the prevalence of long COVID is less than them, is less in the group. And even people who have vaccinated after they've had long COVID, some of them have reported, the easing of symptoms. We don't know yet how it's going to be affected by other comorbidities. So, for example, if a person has long COVID, if they get influenza, we don't know yet how they're going to be affected, or if they've got another chronic condition. But we do know that the symptoms actually need a lot of attention going forward. It does not differentiate it by, as you said, by any variant or anything. It's just more about the susceptibility of the person and what symptoms they have. It might be genetically, there might be some genetic susceptibility. We don't know yet. We don't know who's going to get long COVID, who's not going to get long COVID. And a lot of that we're still trying to understand.
Yeah. Now, in your reflection, one of your tweets, you mentioned that this could drive people to actually be out of work, losing their homes and losing their possession. How severe is the impact on productivity so far from the cases that we have?
Yeah, and I think the most important thing, the other parts of people having symptoms are important. I must admit that. But I think for me, what I find really important is the fact that it does not affect people only physically with symptoms. It also affects people psychologically. It also then affects people, socially and economically. People who used to run cannot run anymore. People who used to do certain kinds of jobs cannot do those kinds of jobs. They cannot clean their house. Their quality of life gets affected. And so usually we would then say, well, these people are not necessarily causing an increased burden on the healthcare system, but actually their quality of life gets negatively affected. People who used to drive cannot drive anymore. So these are the things that in South Africa we haven't really quantified or measured, because we haven't really looked at it from the perspective of the people that are actually affected. We tend to look at this problem from the perspective of how they affect the health system, because that's what we've been concerned with. But I think increasingly it's becoming important to see how the quality of life is affected. And that negative impact, Thabo, it's really what I think we need to address long COVID on, not only on the physical symptoms, but also in terms of how it affects people's lives, because it can contribute to the deterioration of the socioeconomic circumstances around the person, but also it can delay economic recovery if a large number of people are no longer able to engage economically.
Now, in the context, and which is what is really becoming prevalent language these days, is how do we learn to live with this thing? In the context of long COVID, I suppose that conversation would need to be a little bit more nuanced when we say, how do we learn to live with this virus?
Exactly, and it needs to be so nuanced that it does not only look at the clinical or medical outcomes. It must also look at how it affects people in their homes, people in their social circles and social networks, in their employment, and also in terms of how it will affect long-term our economy. And I actually think that for the people that actually have more moderate and severe symptoms, they will require chronic care that requires for them to visit the health system as well. And even that we do not know. Sometimes people don't even know that their symptoms are related to having recovered from COVID. It's so interesting, Thabo, that you don't have to have had severe COVID to get long COVID. People can get mild COVID but end up with long COVID symptoms. So this, for me, I think it's also something that's important to highlight about long COVID.